think vernacular and verbiage has such a powerful impact, but like my back is out, or my hip is out, or, you know, my back is out of place, or all these, or I blew my knee out. And it's just like these really strong words. And sometimes doctors will be the ones that say that.
Welcome back to Straight to Your Health, where we want you to learn something new about healing and your own health. My name is Dr. Gavin Hall. I'm the owner of Straight Up Chiropractic here in Southern Utah. Today we have Devin Orrock.
Orrock, yeah.
Orrock.
But I go by all of it.
All
honestly.
right.
I've gotten that my whole life.
All right.
Devin Orrock.
Okay.
Yep.
You're a doctor in physical therapy.
Correct.
All right. I actually wanted to start off by asking why you don't go by doctor. Because
that came up
we've had great conversation, and and it was every time I'm like, Dr. Orrock, and you're like, no, just Devin. I'm like,
yeah,
okay,
I don't know. I think it. I don't know why I get like a visceral reaction to that. Like it doesn't work for me for some reason. And to be honest, I'm not entirely sure. I can't answer that question fully. I think in my head, I think it just comes down to relatability for me, where it's if I think back on the professors and people and even doctors in my life that I've connected with the most, it's like we've been on that same playing field, right? Where it's like, oh, I'm Steven, right? Not Dr. Kirk or whatever it might be. Yeah. And for some reason that kind of helps me feel more relatable with them. And that feeling that I try to project in my care is, hey, we're partners in this. Like it's not me and you, it's us trying to figure this out together. So I don't know. Maybe I think it's something to do with that. I mean, I take pride in saying I'm a doctor of physical therapy. I love saying that. But I'm Devin, you know, and maybe someday that'll change. I don't know. Maybe I still feel young in my heart, even though I'm not. But it might be something to do with that too.
No, that's awesome though. But I don't know any physical therapist who goes by.
It's rare. I'll be honest. Yeah. I mean, I have a few in my class who go by it, and really good friends, and I don't know, for some reason it just didn't click for me. And I don't see myself in that way, but that's what it is. Well, why do you go by doctor, I guess yes, you have a doctor in chiropractic.
Sure.
Care.
Yeah. I felt in the beginning, actually, the first probably year of my practice, I was like, just call me Gavin. And then I found that there was, I don't want to say a lack of respect, because that makes me feel superior, but that's not the intention at all. Maybe it was the legitimacy that they felt that they were going to a physician, a doctor, for their care.
Got you.
And so when I started calling myself Dr. Hall, everyone started going, oh, okay.
Yeah, they took you a little bit more seriously.
Yeah, the legitimacy and the seriousness, the validity, if you will. That was more just my experience. And so now that I go by Dr. Hall, I don't know, but it makes all the difference. They're like, no, my doctor said this.
Sure. No, that doctor's note, man. I mean, it all comes around to just that title in and of itself. And so I do think I probably miss out on some of that for sure. Okay. But that is what it is. Again, when someone says Dr. Orrock, I don't even turn, right? I'm like, oh, they're talking to somebody else.
Yeah.
And so it's just not part of how I see myself, I guess.
That's great. Well, welcome.
Thank you.
Back again. I'm going to repeat myself a couple of times, but I wanted to bring you on to share your views, your thoughts on physical therapy.
Yeah.
Maybe later in this podcast or this episode, I wanted to go into how you kind of use collaborations with chiros, with all the people. You're in Hive Therapy.
Yep.
In previous episodes, if they've been listening, they've heard kind of what Hive Therapy is and the collaborative efforts that we have there. Mm-hmm. But I wanted to just bring you on, kind of give the idea or the perspective of your profession to this podcast.
Yeah, I'll do my best.
Yeah.
Yeah, I mean, I'll give you my perspective. You're going to
it.
find, Gavin, that I'm really good at talking without actually answering questions. So at the end of this, you're probably going to have
You're a doctor already.
no snippets. You're going to be like, there is nothing that I can use here. And no one's health has improved because of what Devin said.
Well,
I apologize for that.
I have
Hopefully
learned
this doesn't
already
waste your
from you. I enjoyed just collaborating because we've had a couple of conversations about, I had this patient that came in and kind of had this experience. Would you mind giving me your 2 cents on it?
Sure. We're pretty good at that.
I think in chiropractic, we have a certain amount of education that's given, right? And I would significantly doubt that it's the same. We probably had the same basic classes, immunology, biology, chemistry. We've all had
your
those.
didactic stuff is very similar. Kinesiology, I mean, anatomy. We're all going that direction.
Right.
Yeah.
Right. But I imagine the professors taught it to you guys a little bit differently than us. And then you received it differently than I did.
100%.
And so I've actually talked about this on one of my previous podcasts where I said, in the beginning, when I was first understanding becoming a doctor, I never understood why people would say, I'm going to go get a second opinion. Because in my head, when I was younger, I thought, all doctors
one opinion's the same.
All doctors went to the same school.
100%.
They all have a doctorate level degree, so they all know the same information.
Mm-hmm.
And as I went through it, I'm like,
see that.
Well, I was absent on the day they went through this joint.
Sure.
So maybe I don't understand it as well, or because I never went back and studied it. You know what I mean?
100%.
Do you have a similar experience?
Dude, I have 100% similar experience, right? Like, and I think we can both relate to, you have that client or patient come in and they had this information provided to them by some other doctor of something. And in your head, you're like, wait, that didn't resonate with what I've learned, or maybe that's not how I would have handled this plan of care. And obviously you manage that through your conversation delicately, but
without completely offending him,
without completely offending them, or taking out any sort of validity in their reliability and their doctors. But I think that's what evidence-based practice kind of is in a lot of ways, right? I mean, there's this whole lot of literature out there, and I speak for myself, but I'm pretty sure most people fall into this. 0.001% of it, to be honest with you. And then you have your clinical expertise and your niches and what you do. And then obviously that patient sitting in front of you, and you take all those pieces and you're trying to create a plan of care. And what my plan of care is for that person is very different than what yours might be. But I think the overarching goal of every doctor or clinician out there who's trying to improve someone's health is, let's get this person better and do the best we can with the know-how we have. And so, I mean, I have a gal that I'm working with right now, and she's working with a couple PTs up north when she lives up north, and now she's down here, and she's worked with a couple PTs down here. And we're all, I think, trying to get her the same place, right? But we all it's just a different set of eyes. So in a lot of ways, it's kind of nice to have those different perspectives. Sure. And most of the time, that's what it is, right? It's not like, oh, this person's wrong, in my opinion. It's, oh, I see what they were doing there. This is how I'm going to approach this. And maybe the combination of the two might be the secret to unlocking, a better, more optimal you, I guess.
Do you have a patient that ever comes to you and says, well, I'm going to stop this to see if this was actually helping?
Oh, 100%. Yeah.
Because I find that often. They're like, well, I've been doing PT and chiro and this, and it's been great. And I just don't know which one's been the solution. And in my head, I'm like, well, in the end, does it matter? If you're getting better.
Yeah.
Does it matter?
Does it matter? Right. No, 100%. But have you ever had this experience? Because I can think of one too, where the person has spent maybe years thinking about this injury, working with this injury, going to specialist after specialist, where you can tell in your assessment with them, like, this is dominating their headspace and their mental energy, and has been for years, almost to the point where it's probably detrimental, right? Like, and we almost start getting so far in the trees that we kind of almost like, it's nice to kind of look at it. I'm like, oh my gosh, let's just take a step back here. Like, maybe we are doing too much. You know what I mean? Like, you're trying this, taking this medicine, trying this, and like every waking moment of your day is like, how do I get this knee pain to go away?
Oh yeah.
And then you're like, wait, hold on. rather than just be another piece in your million, like maybe we're spending too much. And that's a delicate conversation, right? Yeah. Because, and I don't have an answer to how to handle that or tackle that perfectly, but right. I am thinking of a person specifically where it's like, this is literally moment she wakes up to moment she goes to bed.
Healthcare.
All she's thinking about is this thing she's been dealing with for 5 years. Yeah. And, to most people, that's like go-getter attitude, right? Like this person has got drive beyond nobody. And I love that. Mm-hmm. But then at the end of the day, I'm like, oh my, are we maybe putting too much of our mental energy into this? And because sometimes the second you kind of stop focusing on it 100%, you almost unlock something, you know what I mean? And you are finding improvement.
I agree. It makes me think of, have you ever had patients? Of course, we don't get in the realm of prescription.
Sure.
But if you ever have someone who says, I took this medication and it helped with this problem, but then it caused this one. Mm-hmm. And so then I took another medication for the side effect, and then it's like this downward
cascade.
This cascade.
And then you see this medication history that's
they're taking 12 medications.
12 and plus long. And you're like, oh my gosh. Yeah.
And even though we can't say that, that just came to mind when you were like, well, if I started seeing this physician first, and it helped with this, but then maybe this got worse. And so then he didn't really know about the hip thing, but he was great at the knee.
Yep.
So I saw this guy for the knee or the hip, and I think it's something kind of similar.
100%. And then sometimes you almost feel obligated as the clinician that they've now seen multiple. And, I think you and I kind of fall into that space where it's like, oh, I've seen in my situation maybe 2 or 3 other physical therapists or chiros, and we've been to a lot of specialists and fix me, right? Yeah. And so you almost feel this obligation to kind of pick up where they left off, but it's almost sometimes refreshing to be like, okay, it's great. All of that's been good, and I'm glad they did everything they did, but I'm going to just come at it with fresh eyes instead of almost like you're putting me in this box of get my hip better, you know, and this is what this person's done. This is what this person's done. What can you do different? And I don't like getting put there, if that kind of makes sense. Anyway.
Yeah. Can you attack this problem differently?
Yeah. Yeah. Because then it puts a lot of pressure, and I'm like, hold on, maybe we can, but like, let me just do what I do, you know?
Well, and that actually brings up the next point, that I've heard a lot of backup in chiropractic. There's a lot of different chiropractors.
Sure. Mm-hmm. Mm-hmm.
I mean, you have over 250 techniques.
And I wouldn't know that.
I'll spare you that.
And we've talked about some of those too. And I think educated me on just several. And I'm like, oh, that's just 0.1, 1% of the population of specialties.
The simple version, for those that may not have listened to previous episodes, is that you have this very research-based style of chiropractic, and you have this very, I say holistic, but I think most chiropractors will agree with the holistic view. But it's very much an Eastern style where it's let your body do
anecdotal its thing. Maybe. And,
I don't want to say philosophical, but we say it's the philosophy in chiropractic that if you can just get the spine straight, then the rest will fall into place.
And I can imagine within that discipline, there are branches.
Oh, sure.
Because you can interpret that piece of information.
Oh, yeah.
And create your own thing, really.
Yeah.
Yeah.
But I've had conversations with some of your patients while they're going through and out of the gym, and they'll say, oh my gosh, Devin is by far the best experience I've had with a physical therapist. So this is going to be a 2-part question here. First off, what might you be doing differently? And is there a realm in physical therapy as there is in chiropractic?
Yeah, like are there multiple disciplines within physical therapy?
Sure. Yeah. I know that physical therapy doesn't really dabble of my knowledge with the Eastern medicine philosophical style.
They try to, big part of our education, I think what makes it a doctorate program, or at least how it was described to me. So let me tackle that second part of that question first, is using research and being able to look at research and being able to interpret research based off of its level of merit, right? If we used that hierarchy or that pyramid of, level 1 research is like randomized control trials with, systematic reviews of randomized control trials where they're taking large sample sizes and they're blinding experience. That level of experience is what we really try to work off of, and working down that pyramid to more like of a case study. We're like, oh, this therapist did this with this client, had this outcome, and not trying to base so much of our practice off of that one experience, but really looking at high-level research. And that's, I think, what took it from a master program 20 years ago to more of a doctorate program, really being able to say, because I mean, we're still teaching very similar principles, right?
Yeah.
I mean, with the knowledge of new research and literature, but being able to, after you graduate, say, okay, here's some more research coming, because it's continually being thrown at us. And social media, I mean, they'll take a piece of paper, and if the conclusion said this, they'll broadcast it loud and clear, right? And that can be to the detriment sometimes of maybe just the average person who's like, oh, this article did this, but like, what level of research was that? Like, how good was that set up? But does that kind of make sense? So
Yeah.
So within that, that's kind of where we spend a large part of our time in school, just like making sure that the research and literature we rely on is as solid of literature as we can. And if not, we try to not go too far into the weeds.
Yeah.
So within physical therapy, I wouldn't say there are like two separate disciplines, but we do have like a lot of different specialties, I guess you can say, within it, right? Like you can decide if you want to be more of like a neuro-based, like, and work with those with spinal cord injuries, brain injuries, that kind of realm. Pediatric, which is its whole other ball game.
When I think of pediatric, I think of what is it? The therapy that they come to your house. It escapes me right now. Occupational therapy.
Sure. Yeah.
Is
that they and some of those cares.
How does that work?
That's a completely separate discipline and school and education.
Okay.
But they do work closely together in rehab settings. Like if you go to like an inpatient facility, so like a hospital, where if someone did have a like a stroke, let's say, and the left side of their body has been affected because of that stroke. Typically we think of occupational therapists as more of the more dexterity kind of stuff. So, like washing your clothes, making meals, kind of trying to get back into the daily tasks of it all. And then they separate physical therapy in that setting to be more of the general like strength and mobility and walking. And so what you see, whether it's right or wrong, what you see in those settings is physical therapists, they'll tend to work primarily with the lower extremity. I mean, just in general, this is a general thing.
Sure.
And this was my experience when I did a rotation in a neuro rehab facility. And the occupational therapist did a lot with like the hands or the upper extremity in that particular setting. So then, you'll have that neuro rehab, you'll have geriatric. I mean, but all of them kind of come back to the same general education, and then just what was that niche you wanted to go to? And so for me to kind of now move into more of this first part of that question, what do I do differently? And kind of the field that was more interesting to me and brought more of a passion to me, I guess, was that sports or that sports certification. So after you graduate from PT school, you can go down these disciplines either through a residency program where there are schools out there who are sanctioned through our governing body, which is the APTA, to be a residency program, to help you be more niche in your specialty. Or you can kind of go the second approach, which is accumulate 2,000 hours working with a specific population in a clinic where you're getting paid, plus whatever other requirements there might be. And so sports had that element. And so I focus primarily working with those athletes. I ended up doing a lot of like athletic training. And part of it is you got to be on the field and work with athletes kind of more in a first responder kind of way. So you have to get those certifications along with it and develop the hours with them. And then you take a big test that allows you to kind of just be a little bit more of a specialist in that field, as opposed to just a general physical therapist who kind of sees all ortho injuries, I guess. And so, that's kind of the area I went. And then being in the hive with you, especially, and I feel like you have kind of that similar mindset, at least in the patients I've collaborated with you on and the ones I kind of see you working with. I feel like that's kind of an area that maybe I'm wrong, correct me if I'm wrong, for sure. But that's what I do. I don't know what else makes me super different, but that's kind of a big part of how I do it and the people I try to focus on. And
from my experience watching you, I want to add as well that I've met quite a few PTs. none of them smile as much as you do and collaborate as much with their patients. You tease your patients. You're having fun with your patients as you're working with them.
Maybe that's why it's Devin and not Doctor. Because it doesn't
really
give me that
enjoyed
same.
that.
Yeah, I don't have to be held to that standard anymore.
Yeah,
no, I'm
because
just
you
a
have
guy.
you have some PT. Do this.
And
No,
then,
you're not going deep enough. Do this.
yeah, sure.
You know,
Yeah.
and it's very much a, I don't know, just more of a strict protocol,
Yeah,
if
yeah.
that makes sense.
Yeah, and they just kind of are their arms folded, counting reps.
Yeah, and so I would add that there's, I think part of this biopsychosocial thing
Sure.
where you get into the attitude that you're in when you're going through a healing process, I think does impact the healing of the body.
I 100% agree with that. And so many clients will say that. They'll be like, you know what? I came for physical therapy, but we got emotional and mental therapy along with it.
Yeah.
And I'm like, yeah, I mean, I can't claim that. But I had this client come in the other day, and she was a professor. I didn't know this, but we were just talking, and I'm like, wait, hold on. It was the assessment. I'm like, are you here to help me, or am I here to help you? Like, because it just felt like, and she's like, well, I am a teacher in, psychology. And I'm like, oh, that makes a lot of sense, because I feel like I'm being educated here.
You're sitting through your own little therapy
maybe I should be
session.
paying you for this, because now it's just turning into something else. But yeah, no, that's true. I think I try to bring that in, is just become friends. And I don't know, I'm sure it's similar with you, but a lot of them do become friends. And I think that's the other thing with PT, is sometimes you're seeing these people through their care, multiple visits, right? So it starts off as kind of a client-doctor relationship for sure, and it always is, and there's always that professionalism I try to keep, but as you become more comfortable with them, it becomes also a friendship mix, right? So you're balancing professionalism and friendship and all those different things.
The toughest part.
It's hard. It's hard.
And I think that may be to answer that first question of back to me of why I go by doctor. I'm like, it helps me establish that, maybe just in my head.
Yep, it keeps
but it does help draw that line.
And it does. It really does, right? Like I think of even my professors, right, that were like, no, you call me Dr. So-and-so versus call me first name basis.
Sure.
And 100%, like when I would go, visit for office hours to ask them questions, it was more of I'm coming to you for guidance versus, let's also chat and have a good time and then help me with this. But at the end of the day, the ones that I was like, I feel more of a connection with were, I guess, the ones that had also that friendship element in there. Yeah. So maybe that's why I kind of deviated that way.
Okay. All right. Well, if you were to tell any listener right now a common misconception that people might have in or with physical therapists, what would that be? What comes to your mind?
I mean, the first one that comes to my mind, I don't have a ton, because I think a lot I'm curious to hear about your experience with this, because I have a lot of misconceptions that come to me about chiropractic. Sure. I feel like, right? And you probably have the other way around. Like, people don't typically come to the physical therapist and complain about physical therapy, right? They'll come to the physical therapist and complain about everything else they've done.
The other something.
And then I'm sure it's very similar in your situation. It's like, I'm here because my physical or whatever, my massage therapist, whatever happened.
And in that, just quick with that breath, when people are like, well, why are you sending me back to Devin? He's just a physical therapist. I'm like,
sure. Same thing.
I think you're going to like him more than you like 100%. Previous.
And that's and I think every time we've worked close with each other, with our clients have had positive experiences. Agreed. I've never had anybody be like, same thing happened. And it's like, you didn't try. Anyway, point being,
sorry, continue.
Sorry, the misconception. I mean, the big one I do hear is this is going to hurt, right? Like, I think pain is associated with physical therapy. There's a lot of jokes like personal or physical torturer.
Push through the pain.
Push through the pain. No pain, no gain. And I think there was a time in physical therapy. In fact, I've met now retired physical therapists who took pleasure in, when we're trying to get that range of motion back after a total knee replacement, how far can I push it? How much can they scream? One would tell me he would just sing louder when the person was screaming, and he had people pass out on his table.
Holy cow.
I think there wasn't, maybe that was the education at the time. And thankfully we've come to a place now where that's not the case, right? I think it's very similar if you're coming into me, my goal is to have you feel hopefully a lot better, but even marginally better than you did when you walked in this door.
Sure.
And the no pain, no gain philosophy is definitely out the window. And, repetitions and comfort is often what I'm saying. And motion is, we still need to move, and maybe it's not going to feel nice, but is this going to hurt? Am I nervous? Some people walk in like shaking, because they're like, last PT I went to, it hurt.
I'm back again.
Yeah. It was like a 10 out of 10 pain when they stretched me. And I'm like, oh my gosh, I'm so sorry for that experience. So that's probably a big misconception. I think the big one, and this is going to throw back at you.
Bring it on.
The one that they always come in, and I think vernacular and verbiage has such a powerful impact, but like, my back is out, or my hip is out, or my back is out of place, or all these, or I blew my knee out. And it's just like these really strong words. And sometimes doctors will be the ones that say that, and they go in and, oh, your back is out of place. And it's like, ooh,
your rib is out.
Yes.
I have a rib out.
My rib is out
so often.
I know. How do you, so that's a misconception that everybody, and they just kind of talk it like it's normal daily. And and it really kind of, it's hard to loop around and be like, well, actually your joints are in place.
If they were out, you wouldn't be here.
If it was sublexed or dislocated or fractured, there would be an excruciating amount of pain right now.
Yeah.
But doesn't, there's obviously some imbalance happening at that joint, and there's a lot of different ways we can manage this.
Yeah.
So that's, I guess, another big one that I think both of us probably experience. And in some ways, both of our professions could contribute to, sadly.
I agree.
Yeah.
And I with my rib is out, my back is out, I threw out my neck, whatever that is, in my opinion, I think it's because whoever that first or previous physician they've seen did a poor job at explaining what is happening.
Agreed.
I take a full hour my first visit, and most people are super annoyed by that in the beginning, and then by the end they're like, I've learned more in the last hour than, you know what I mean?
I've heard that from a lot of your clients. Like, your education piece is exceptional. Like, you just do a really good job of explaining the whys behind everything.
It bothers me when someone will come in and they'll say, my rib is out. I'm like, well, really quickly. I don't want to say anything negative about the previous physician or physicians.
No, this is good. I'm glad that you kind of discussed that.
But this is how the body works. If it was out, you wouldn't be here. When we say out, we say partial dislocation or subluxation in chiropractic, which is just misalignment of you tweaked your back. I like the term, I tweaked my back, much better than I threw out my back. That, sure, you misaligned the joint. And that's in chiropractic where we like to specialize in saying, okay, let's find the joint that's the problem and just straighten that back up just a little bit.
Okay.
Because it's lacking that range of motion to be able to rotate back into alignment. And so that's the argument that we make in chiropractic. But when you get more into this philosophical side of chiropractic, that it's this, you misalign that joint. That joint is now pushing pressure on a nerve. That nerve is now not able to breathe, and it's causing problems into your stomach. It's causing problems into your heart. You have heart palpitations because your spine is misaligned.
Let me fix this for you.
Let me fix that. And we can fix cancer. We can, you know what I mean? You get some people hard in that area, and I'm like, oops. You got to watch your mouth, man.
I hope you're paying a lot of malpractice insurance.
Agreed. Because you can claim all day that we're going to help with your back, your neck pain, if we can correct that, that motion that's not happening. But anything past that, in that philosophical realm, I say, if it helped your stomach problems, I'm happy for you. If it helped the other things, I'm happy for you. That cannot and should not be the goal from the position of the physician. That I shouldn't be telling that to my patient, that, no, our goal is going to fix your stomach problems by tweaking this joint.
I agree. Yeah. Yeah.
So maybe
I don't know if that
very
answers
similar. The question. But.
Yeah. I kind of go the same direction with them. And I mean, I guess every case is individual and how that works. But, if a joint feels like it's misaligned or not moving properly, a lot of my approach too is addressing the soft tissue because of its connection to those individual joints, right? Sure. I mean, you have one muscle that's maybe super tonic and it's pulling, your hip into a position that's not ideal, or you know what I mean? And then it's
yeah.
having this effect on your spine. And hey, if we address the soft tissue side of it, it might help us get out of this. Because, they're like, oh, I just go to the chiropractor every week to get my hip back in place. And I'm like, okay, how long have you been doing this?
Exactly right.
Like, oh, I've been doing it for 4 years. And it's like, okay, well, let's figure out why it, quote unquote, feels like it's coming out of place.
Yeah.
No, but that's, I'm sure you're not, you've heard that too.
Yeah. I just have to go to my chiropractor regularly, and that's the solution. I'm like, okay, well, if the joint keeps misaligning,
if this is
a
recurring issue, if that's the problem, let's start with that.
Yeah.
And that's so important, right? Like
Yeah.
just taking that step back and be like, maybe there's something else going on here than just your quick short-term feel good for 5 days before you need that 6th day hit,
Well, if you've had any of your patients who've gone to, I don't want to name names, but there's a local chiropractic office that you do monthly subscriptions to, and you can $60 or something like that a month, and you can just go in 4 to 5 times a month, and you get cracked and walk out, and it's like a 5, maybe less minute visit.
Sure, I know exactly which one you're talking about, because I have patients who go to it.
In chiropractic, we consider that area or that location kind of the McDonald's, or the McDonald's of chiropractic.
So I guess it has its place.
It has its place for those who want the pop
that
in their
pop
out.
in their out. Yeah.
Yeah. If you want I have pain in my back, then I would say you need to find someone who's going to give a little bit more attention to what's causing that something.
Agreed. If you're just looking for that quick adjustment just because it feels good, great. But if you're dealing with a recurring problem, let's get to the root of this.
Well, we have something in the joint that's called nitric oxide that I have to explain as well to people, that I'm like, hey, when the joint moves, that popping sensation releases something called nitric oxide, and it causes that relaxation that you go, pop.
There is a physiological release just in the joint. I mean, that's shown in ultrasounds and stuff, isn't it? I mean,
and then nitric oxide becomes addictive. It legitimately, you get the people who will pop their fingers every day.
Oh, shoot.
Or they self-pop their neck, and they're like, it's great, I can pop my own body. I'm like, that's great. Just be aware that it's actually addictive, and the more you do it, the more you're going to want to do it.
Yeah. Sure, there's dopamine pathways associated with it.
Give yourself that hit, though, instead of having to buy it from your dealer. So, anyways, I digress with that one. I apologize.
No, but it sounds like you and I have had similar, at least in that specific, I don't know if that falls under misconception, but that's one, I guess, thing that I deal with regularly is vernacular. And, I had a gentleman come in. I went running the other day, like 5 years ago, no pain. But the next day, my knees were a little bit swollen and sore, and I blew out my knees. And I'm like, did you?
They just exploded.
Is your ACL still intact? That's the word I would use to describe a blowout, is like a ligament
That
rupture.
makes me think of like a tire explosion.
Yes. Yeah, not a little inflammation response and some pain from a novel activity. But yeah.
Cool.
I guess, what are some that you deal with, maybe with PT?
I don't know if it's specific to PT. I experience the same thing with other chiropractors, as we were kind of talking about earlier, that I've gone so many times and it's not helping.
Mm-hmm. Yeah.
I get the same thing from, like I said, chiropractors as well. And I'm like, we've had this conversation a little bit. I'm like, let's do X amount of visits. And if it doesn't seem to go anywhere, let's try something new.
I'm the same way.
Because what's the definition of crazy?
No, I recognize my limitations. And I think that's one thing that I really like when I'm working with you specifically is, I mean, we use the term staying in our lane, but, we recognize what we're good at.
Yeah.
And we know that that's not for maybe every single injury. Like, I'm not going to claim that I can, you have some, no matter the injury, come in, I'm going to get you better. No matter the injury, come in, let me try. And if we're not seeing improvement within, 4 or 5 visits or less even.
Sure.
Like, if you're not seeing some improvement, then I may not be either A, we need to come at it from a different angle with me, or B, I may not be the practitioner for you now at this point.
And then I go back to that same idea, though, of, well, maybe someone else had a different style of education that might be better addressed for your problem. So that's where I'll say, let's go talk to Devin. He's had a different education than I have. Let's go talk to, someone else who can come at it from that other perspective. If I've tried that other perspective from my head already, and it's just not getting it.
Yeah. I think that's a big thing we were taught in school too, was collaboration. I mean, I think it falls under one of the big values of and I think that just says wonders to the fact of, hey, we got to put our hubris and our pride aside, because I think all of us want to feel like we can help anybody in some way. Yeah. But it's also like just as important, if not more important, to recognize our limitations. And, there's some practitioners who claim they can do it all. And that's kind of a big turnoff for me in a lot of ways. And I won't name names, but I think we've worked with some that have done that. It's just important to know where your strengths are and where your weaknesses are, and then realize in an assessment like, oh, there might be a better option for you. Yeah. This is what I can provide. And if this is what you're looking for, great. But you might actually do better over here. And that's humbling to say in a lot of ways. You're like, I'm not going to fix you.
Well, I feel like as well, the patient receives that and goes, you're being straight with me. Yeah, you don't just want the money from the visit.
Yeah.
And so.
And my experience in doing that, it fosters more like respect than it does like, oh, to heck with you. I was told you could help me. No, it's like, well, this is what I can do. And it might help a little bit, but I think we're going to need more of a team approach to this.
Well, I had someone who sends me a lot of people now just because I tried to fix, I think it was his back. Mm-hmm. And I said, like I do with most patients, I'll say, let's do 4 or 5 visits, see what we can kind of do. Mm-hmm. If we don't get anywhere, let's try something else. We got to 4 visits. He's like, no change. I'm like, all right, let's try physical therapy. And he went over to you and he's like, he gave me a couple of exercises. I do them every morning. Haven't had pain since. Fantastic. I am glad because I don't want you to have a negative experience by saying he just wanted me to keep coming back over and over and over. And all I needed was exercises.
Yeah.
And so he now sends me a bunch of people just because he's like, hey, this guy's going to shoot you straight.
This guy's going to shoot you straight and he's going to give it his all. And I think that's the important part is he felt like, hey, Dr. Hall did everything he could to get me to the spot. It didn't work, but he didn't drain my bank account to tell me it's not going to make a difference. Yeah. And so that's probably one of the more negative things you kind of hear in all standards of care is I went 20 visits to PT and, sometimes I'll see them and all they're doing is like the very basic exercises. And to PT's credits, I've worked in those like high volume areas where, there's maybe 6 clients and 1 PT man. It's a very stressful, difficult place. And that's why I got out of it. But it's hard, because you're working with one and you have other 5 trying to move and do exercises. And your only hope is please don't make it worse, because they're doing the exercise wrong from across the room and you're like, oh crap, like let me put your leg down for a second and we'll go over there. And so I can see why in that situation, we're just giving them the very basic movement patterns to just A, try to get some improvement, but B, definitely don't get worse if we say, versus where if you can be one-on-one standing right there next with them, you can really correct those things immediately if there is a discrepancy happening. But I guess that's what I'll say on that.
That's awesome. Well, are there any things that you feel that would be good for the listener to know about physical therapy or maybe the interactions that physical therapists have with chiropractors?
Anything. I think we've covered a lot of good ground. I think coming out of PT school, I think I wish I would have known. I don't know if it was like this in chiropractic, and I'm actually curious on your point, but you almost come out, and I don't think it's actually said from the professors or anything like that, but maybe it's just kind of the perspective you develop with your peers. But like you kind of come out thinking, okay, PT's number one and everybody else is, sub to that.
Sure. Does that your profession
is superior.
Oh, sure.
And I don't think it was ever professed at any point, but kind of just as you go through, and maybe it's just us as humans, you just like, what I do is superior.
Sure.
And then you come out and you're like, whoa, you kind of have like an eye-opening experience. And I'm finding over and over, and it's reinforced every time I do it, but just collaboration in general. But it's important to find, I think, like-minded.
Yeah.
I mean, I would say that you, maybe correct me if I'm wrong, but you fall more on that evidence literature, you're looking for high level of evidence to kind of dictate at least parts of your plan of care.
Parts.
Right. And to me, since I kind of come from that school of thought, like it just, we click, and so I feel super comfortable sending people to you because I also think that people migrate to like-minded, right? Like
Agreed.
there's a lot of people are going to, if they want that more, that more outside of that Eastern approach, I guess, if we use that term, they're going to go there and they're going to hopefully feel better, whether it's placebo or otherwise. And those who want more of the research and the literature to kind of back their plan of care, they're going to come find you or I. And I don't know. I just wish I would have come out of school and I was like, oh, we're all in this together. Let's not villainize the other people and
I feel like there's
demonize that
head crunching.
Yeah, absolutely.
In my profession, at least, that they're like, oh, PTs, and actually you got chiros now who are getting into the rehab space, and I'm like, guys.
Well, to that point, you have massage therapists getting into the rehab space, and you have personal trainers, that weekend certified specialist getting into the rehab space. And, they're not using the term physical therapy, but they might throw the unprotected term rehab around it. And that rubs me more than anything, I think, because I'm like, well, chiropractic, that's a, you're going to I'm guessing 3 years. Is that what it is still?
3.5.
3.5 years of education, and you're passing your boards and all these different things. It's quite a rigorous process. And so even if I find that they're providing corrective exercises and doing, like, I'm imagining that was part of their education versus, I'll see a personal trainer doing stretches and doing things. And I'm like, oh, like,
that certification online didn't do you well.
Like that online certification and YouTube video, like it's hard, right? Like,
sure.
But anyway.
Nothing against personal trainers. If you're listening to this, we don't want to offend.
No, 100%. I'm a certified strength and conditioning specialist. Like I went and got that certification, and I recognize what its limitations are or aren't. And when it comes to getting people stronger and moving, they're excellent at that, But if there's an injury, if it's minor, like a tendonitis, maybe they have that mindset to, modify exercises, but sometimes we can make it worse. And 100%. I don't mean any disrespect. It's not the majority that I'm talking about. There are the minority in every group, and that's even physical therapists who claim to crack backs just as good, or, I don't want to use that term, but,
that's fine.
Provide adjustments, or they try to get into the chiropractic space, right? You know what I mean? And and I'm like, hey, that's not my lane. I'm not going to say that I can do that.
Yeah, and I'm in that boat as well. But I think what happens, in my opinion, again, is that you'll get chiros who will go, maybe I like the physical therapy side of this a little bit more. And so I don't want to switch schools because the doctorate level degree is still a doctorate level degree, even though I want to do this maybe a little bit more because it vibes with the way that I do it.
So they kind of turn into physical therapists.
Yeah. And then they provide the manipulation of the adjustment as well. So that's my opinion on that. I don't know. You'd have to ask. I have actually got a great buddy in town who does rehab chiro. He's over by one of the local high schools. But he's a good guy, has every good intention. And I know that he just has beef with PTs.
Sure.
And I'm like, I think you're the one that created that beef when you stepped into that realm.
When you stepped into that realm, it probably created a competition, unfortunately. But yeah.
Well, cool. Well, thank you for spending this time with me. It's been great chatting with you. I hope we can do it again.
Yeah, we need to, obviously. And obviously we'll keep working with each other closely. But it's just helpful to kind of, I think, see, I mean, we chat here and there and we go back and forth, but I don't know, just these conversations. I'm like, oh, okay, I see even more of Dr. Hall, and I feel even more comfortable with some of his approaches to things. So, thank you for having me.
It's just to stimulate conversation between like-minded individuals, and maybe the listener out there says, well, I learned something today. And that's my goal of this podcast.
Yeah, 100%. Yep. All right. Well, thanks, Dr. Hall.
Thanks, Devin.
Yep.